Have you heard about Governor Gary Herbert's Healthy Utah plan? If you haven't, you're not alone. The plan would expand Medicaid to cover uninsured Utahns. In tonight's Primetime 5 Insight report, why a growing number of people believe passage of Healthy Utah is critical to the state's economy.
I make some money, but still, I send money to Mexico for my family. I had to pay bills here. See.
Ramon Montelongo has been a full-time pastry chef for more than 25 years, but he still can't afford a private health insurance policy. Montelongo, who is a diabetic, doesn't qualify for Medicaid and can't get subsidies under the Affordable Care Act.
It is very frustrating, yeah, because I just can't afford to pay it.
Don't qualify and can't pay means no preventive care.
Right now, these are folks who are going to the emergency room for primary care, or they're putting off care until it's so bad.
It's a similar situation for more than 50,000 Utahns cut off from Medicaid because they're above the poverty level, but still working one or more jobs.
This idea that somehow these are people who don't work and aren't trying really is a misconception.
They're not somebody playing the system. They are our hard-working neighbors.
Lawmakers on Capitol Hill are debating how to close the gap for those at or slightly above the poverty level. That's about 95,000 people here in Utah. Governor Gary Herbert is proposing to use Medicaid dollars to offer private health care to the uninsured. It's called Healthy Utah.
Fuses money into our economy and helps those who are vulnerable in our society, those who really are low income, working poor, and their families.
Herbert says the plan respects the state's uninsured and its taxpayers because right now, Utah is sending $800 million tax dollars to Washington to help expand Medicaid coverage in dozens of other states. Healthy Utah brings $600 million of those dollars back home to fund insurance coverage for the poor.
And the ideas that could bridge the gap so that health is not the reason that they become more impoverished, or health is not the reason that they become ultimately disabled.
Again, I would speak in favor of this and point to the economic activity that this would generate within our state.
In a rare show of combined force on Capitol Hill, Utah's business, manufacturing, and mining communities have teamed up with healthcare providers to support the governor's plan.
Every other solution I have seen costs Utahns more money and covers fewer people. We simply believe it's time to act.
Questions remain, such as what would happen if the federal government pulls its support, or it isn't enough. Herbert says the program can be funded or even shut down if rules at the federal level change. But
we should not say, on the off chance that something will change 5, 6, 10 years down the road, let's not do anything today. I think that shows a lack of courage and a lack of compassion.
It's that passion for the patient that has Healthy Utah supporters convinced the program will survive legislative surgery.
I am optimistic about it.
I think that the chances of this program passing are really good. This is a program by Utahns for Utahns. It's gonna work.
Other plans are also being discussed. A House Republican plan would cost less and cover fewer people. And a proposal from Democratic Senator Gene Davis would fully expand Medicaid. Healthy Utah will likely be debated and voted on in the Senate on Wednesday. Deanie?